The man credited with organizing Liberia's response to Ebola says the key to coronavirus is contact tracing. Our national investigative team talks to the man who brought the African nation's Ebola cases to zero. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
One newspaper labels him a hero. Tolbert Nishwa led Liberia's response to the 2014 Ebola outbreak, employing a strategy many health officials in the United States say now is critical: contact tracing.
So you traced millions of people in Africa?
Oh, yeah, we did.
Contact tracing means just that. When someone tests positive for COVID-19, you trace their contacts and monitor those contact symptoms.
That's how you know how you stop the disease, because by isolating people from their household and from the community, you stop the transmission chains.
As states prepare to open, many leaders are trying to ramp up contact tracing efforts. But it's not easy because most state health departments are understaffed. Louisiana says it needs to hire at least 700.
People are staying at home, so there's fewer people that we're having to track. So it may be that we need fewer people than we're estimating, but we'd rather overestimate and have too much supply than find ourselves unable to do the work that we need to do.
In Ohio, the goal is to hire 1,750.
When you consider that so far we've had 15,000, somewhat over 15,000 confirmed cases at this point, we can see that's a lot of volume, and to do this kind of follow-up with that number of people really requires a substantial workforce.
Nishwa now does research at Johns Hopkins University, where a recent study estimates our country needs 100,000 contact tracers.
Are there any countries doing contact tracing the right way right now?
Oh, yeah, in Asia, Hong Kong, South Korea.
Both of those countries have been able to flatten the curve. In the last week, Hong Kong has reported just 12 new COVID cases. South Korea, 64.
If we miss one case of COVID-19 in the community, there will be new cases of the outbreak.
The Johns Hopkins study says as we ease strict social distancing measures and make progress toward returning to work and school, we must identify and trace all close contacts of each case. The study explains the importance this way. If one person spreads the virus to 3 others, that first positive case can turn into more than 59,000 cases in 10 rounds of infections.
At Johns Hopkins University, Nishwa continues to focus on Ebola and other infectious disease transmission. Up next on Valley News Live 10 at 10, a decision to take one of Universal's movies straight to the viewers staying at home during the pandemic paid off in a huge way.